Antibody therapy for cancer in children. What is it exactly? How does it work? And who can even get this? We'll explain all that in this video. You might already know that antibody therapy is a specific type of immunotherapy. It uses something we all carry inside us and that protects us. Our body's own immune system, because that's what it's for. To recognize and fight all pathogens, diseased cells, and toxins. The idea behind it is as simple as it is brilliant. But what role do antibodies play in this? As part of the immune system, antibodies have one main task. They attach to suspicious cells or invaders and mark them. That way, the rest of the immune system, or rather, the rest of the body's defenses, knows these cells are dangerous and can take action. But how do antibodies do that? The secret lies in their shape. They're actually shaped like the letter Y. So 2 arms and a kind of stem or stalk. That's no coincidence, of course. With their 2 arms, they can dock onto very specific structures found on the surface of harmful cells, like invading viruses, bacteria, or even cancer cells. And this means that the different structures on the cell surface are actually crucial for recognition, like these little bumps, or knobs, or spikes, or some other unusual recognizable shape. These structures are called antigens. So these bumps, or whatever is on there, those are the antigens. Very importantly, every cell has a different surface structure. You can see that clearly here. This one looks like this, or this one like that. Totally different. And every antibody will form a bond with this very specific antigen feature, like a special key that only fits into one lock. Otherwise, nothing is going to happen at all. So it doesn't fit here, it doesn't fit here. Here, not quite right either. And here, maybe suddenly it does. That's how it works. But if both match, then the antibody attaches firmly with its little arms. This one is way too big, of course. In reality, it fits much better. It attaches to the structure and marks the cell that way. And the lower part, this one here of the Y, then sends out signals, for example. And that's the important info for all the other immune cells to start marching there and help to eliminate the harmful cell. And yes, that's exactly how antibody therapy works too. The only difference is the antibodies aren't made by the body itself, but in a lab. They're specifically developed to recognize certain very specific antigens that are found on, for example, a cancer cell, so they can make it visible to the immune system and help the body fight it. The special thing about this therapy is that it uses the body's own defenses and also targets the desired cells. This means that damage to cells that do not carry this antigen, all the others, can be largely avoided. Which doesn't mean there are no side effects at all, but we'll get to that in a moment. The process usually looks like this. The antibodies, are given as an infusion. This happens in specific cycles, at fixed intervals, which depend on the treatment plan. A single infusion can take several hours. In exceptional cases, the infusion is also given over several weeks. Then a mobile pump is used, which children can carry with them like a backpack. But usually this therapy, especially at the beginning, involves an inpatient stay in your clinic. This is also because antibody therapies can cause side effects. These side effects are usually caused by an intense reaction of the immune system. Yes, this can result in a fever or nausea, for example. In rare cases, circulatory problems can also occur, which must also be treated. That's why patients are closely monitored and cared for during the treatment. Okay, so that was already a lot, yeah. So let's summarize once more. Antibodies are part of our immune system and help to recognize invaders and altered cells. In antibody therapy against cancer, this ability is used specifically, except that this time the antibodies are produced in the lab and are deliberately programmed, so to speak, for certain cancer cells. This makes the therapy very effective and targeted, which doesn't mean it's completely without side effects. So far, so good. Yeah. But not everyone receives antibody therapy. How is that decided? Whether antibody therapy is even possible depends on several things. But the most important point is that the cancer cells have a suitable antigen, that is, or target structure that can be attacked. And to find that out, in cancers for which antibody therapies already exist, tumor cells are examined in the lab to determine if they carry a suitable antigen. For children and adolescents, there are already antibody therapies used for patients with leukemias or lymphomas. One example of this is blinatumomab. blinatumomab belongs to the so-called bispecific antibodies. This means it attaches itself with its little arms. Yeah, not just to one, but to two different target structures at once. Let's say this one as well, for example. Yeah. Namely CD19, which is a specific or special antigen that sits on the leukemia cells, and CD3, which is another antigen found on the body's immune cells. And so the two are brought together here, like this. Brought together, and the immune cell can specifically destroy the leukemia cell. So practically two birds with one stone. What also exists are therapies for neuroblastoma, that is, tumors originating from the nervous system. Usually surgery is performed first, followed by chemotherapy. And then, this is followed by immunotherapy with the so-called anti-GD2 antibodies. This is intended to destroy the last tumor cells that may still be floating around in the body. Basically, however, it is currently still the case that most antibody therapies for children with cancer are still in clinical development. This means they are not yet officially approved, but must first be researched further. So you can only get access through clinical trials. If such a therapy is an option for your child or you as a teenager, the doctors will discuss all the possibility in detail with you and also see whether participation in a suitable trial might make sense. And if you would like to learn more about clinical trials, here is a note: we have also put together a few videos for you on this important topic. They answer all the important questions, such as how clinical trials work, what the requirements are, or how safe they are. So feel free to take a look there too, to find out more.